Hey everyone! Welcome to the Dr. Mama Minute, where Dr. Burton will share snackable bits of information based on things going on in her life, in her practice, or things being discussed in her social media channels. So sit back and prepare to be dazzled by topics that you may or may not have thought were important in your life.
Hey there everyone, this is Dr. Burton coming to you live from my screened-in back porch on a beautiful Sunday afternoon. So between my puppy and the chirping birds, this could be a recording adventure. But here we go, and this is the next mini episode of the Dr. Mama Says podcast, which I call the Dr. Mama Minute, where I want to share my thoughts today about a health professional collaboration that many people have not thought much about. Most of us understand that different types of physicians can manage lots of the same medical problems. For instance, coughing, stomach pain, headache. These are 3 really common problems that I treat every day. And I often share management of these patients with physicians who also specialize in lung, stomach, and brain diseases. Today, I want to highlight why parents need to understand how important it is for pediatric dentists and ENT surgeons to work closely together to improve the health of their young patients. Just to clarify, some of the things that I'm going to talk about could apply to adults. It applies to the adult dentists and their ENT surgeons, but because kids are not mini adults, some of my information may not directly apply to you. But you can take some of this and take it to your grown-up doctors and discuss treatment options with them. Could be an entirely different approach from what pediatric dentists and ENT physicians do with kids, but it might be a good point to start a conversation with your physicians. Basically, since I am a pediatric specialist and I'm mostly talking to parents, I'm going to focus on kids because I love kids and you should too. Just saying. Anyway, ENT physicians treat many patients who could benefit from dental evaluations. Pediatric dentists deal with oral health problems that are often impacted by some of the nose and throat issues that we take care of every day. Each healthcare practitioner tends to focus directly on our own areas of expertise, so as we move on with our daily lives, we assume someone else is caring for the other areas. But I've realized that assuming is never a good thing. After 30 years of practice, I now ask who is managing some of these other things that I discover on exam or during our conversations. Sometimes parents say, no one, because it's not that bad. Let me just take a minute to say, if it's bad enough to concern you or for you to look for treatments online, it's bad enough for you to seek help from a professional. As you know, I've already posted many blogs and podcast episodes that share tips about allergies and stuffy nose problems. I've discussed important functions of the nose and why mouth breathing can have long-term complications. Links to some of these posts that might be significant are in the show notes if you want to go back and check it out. I routinely concentrate on improving nasal breathing with improved allergy treatments, sinus infection treatments, and of course my favorite, nasal saline washes. But I never focused on changes that I noticed in the jaw and teeth development of my patients. Why? Because that's not my job. I see many kids whose teeth do not line up correctly or have obvious developmental abnormalities of the upper or lower jaws. Sometimes it's significant enough to cause me to make adjustments during surgery just to compensate for their altered anatomy. Again, I assumed that after a child's breathing problem was improved, parents would move on to the pediatric dentist to discuss the jaw and teeth development concerns. But many of these young kids often did not move on to have these evaluations addressed until they were teenagers ready to get braces. But by this age, many of the changes are harder to reverse. I really want to emphasize to parents everywhere that when you finish having one problem treated by one specialist, regardless of their field, if you still have other issues, don't assume your child's going to outgrow it. Get it evaluated. I've always referred patients to other physician specialists to continue treating problems beyond my scope of practice. However, over the past 5 years, I've begun to work more and more with an amazing group of pediatric dentists, dental hygienists, orthodontists, and speech therapists. While working to treat some of the classic ENT problems, I've started having discussions about the crooked teeth, the overbites, underbites, and other dental concerns that I have absolutely no idea how to address. But once the conversations start, parents often voice their desire to go ahead and get those dental problems evaluated sooner rather than later. And now I have a list of local pediatric dentists that I share with patients so they can begin having earlier discussions. Likewise, many pediatric dentists in my area who used to simply treat dental concerns are discussing more and more about the causes of mouth breathing that may benefit from an ENT evaluation, and some of them are referring more patients to me. It's a good collaboration that really we didn't do a lot of, and that now in our area, and I'm hoping in other areas, more of this will start happening. There is one other group of healthcare professionals that I also now refer to. What is orofacial myology? I know, that's a big group of words, hard to spell. It was hard for me to come to grips with it all, but I promise you, I had never heard of this group of healthcare practitioners until 5 years ago. I fully understood how speech and dental specialists worked with my patients for long-term improvement, but this group, well, in addition to classic speech therapists and dental professionals, I've started working with orofacial myologists, OFM. Please go to my show notes and click on some of the links because I'm going to be hitting on the surface, just introducing a concept that may be something that you're needing. You don't even know you need them, but you might need them. This group of health professionals actually have a very niche practice. They use techniques called Myofunctional Therapy to treat disorders of the muscles and function of the face and mouth. Okay, so that's still not clear enough? Let me give you an example. If you have a chronic mouth-breathing child or a child with excessive drooling, you may eventually need the services of the orofacial myologist. I'm going to clearly miss out on some of the nuances of what they do, but many of the disorders and problems they treat have had a bad impact on things such as breastfeeding, the growth and development of the face, chewing, swallowing, speech problems, teeth occlusion, meaning that overbite, underbite, crossbite, open bite, the teeth aren't lining up correctly, jaw joint movement problems, oral hygiene in general, or the stability of the orthodontic treatment after the braces are put in there. Will the results be maintained, and even just the general appearance of the face? Just because I've removed your child's adenoid or performed sinus surgery or found the perfect medical management for allergies, this does not automatically mean your kids are going to close their mouths or speak more clearly. Additional therapy may be needed to retrain those muscles. So when should parents request appointments with a pediatric dentist? Basically, the point of this episode is to highlight that pediatric dentists treat a wide variety of problems. Clearly, most people understand to call their dentist for standard care, such as for tooth pain, injured teeth, infections, preventative cleanings, whatever, routine dental things that you think about. However, if you are concerned about an ongoing problem after your ENT or allergy or other physician has taken care of your child, consider requesting a dental evaluation. Although kids outgrow many problems, some of them do lead to lifelong problems that might have been prevented had they been addressed sooner. If your child has chronic mouth breathing, please don't simply say it's a habit. Every day, parents tell me they always just thought it was a habit. In fact, teenagers tell me that they're actually breathing out of their nose and mouth at the same time. I love that answer. Every time they tell me that, I go, really? Show me how you do that. And then I sit there and watch them as they try to inhale through their nose and mouth at the same time. Go ahead and give that a try right now. It doesn't really work that way. But anyway, if you are seeing a problem that has not resolved, you might want to get it checked out instead of just waiting to see if it will go away on its own. If your child has some jaw or dental teeth alignment issues, even though you may not be thinking braces are needed, some of the orofacial myologists and dentists, they have some really cool appliances that they put into kids' mouths at night. Yes, even young kids, 4-year-olds, 3-year-olds, they have incredible follow-up images where they take a picture of a child with dental issues and the child has been sleeping with this bite block. Yes, the kids spit it out at night, but even when they wear it every night for a few months, there is already a change in the alignment of their teeth and jaw. Healthcare professionals have extensive training, and we love to share our knowledge. Please don't hesitate to ask. So, my minutes are up for now. It's time to go. Until the next time.
Thanks for listening to the Dr. Mama Minute. Now you can go back to living your best life.